All right, well, we'll kind of get started. My name is Sheila Gibbons, and I'm the director of the Euclid Chamber of Commerce. So welcome, everybody, for joining us here today. And on behalf of all of my colleagues at Beechwood and Heights Hillcrest, Mayfield, Solon, I know Tom is with us today, and the Warrensville Heights Area Chamber of Commerce, thank you for joining us. Thank you also to our generous sponsors who've helped us support our missions. We all work really, really hard to serve our members and the business communities, and we're really grateful for all of these organizations for helping us take care of that. So now I would like to go ahead and introduce our special guest for today. Peter Young is a senior healthcare services consultant at Paramount Preferred Solutions, with more than 18 years of experience in the healthcare consulting field, and he's also a board member of the Beechwood Chamber. PPS is a Northern Ohio owned and operated TPA, MCO, and employee benefits claims administration company with offices in Cleveland, Toledo, Columbus, and Wheeling, West Virginia. Since 2008, PPS has been endorsed by the Northern Ohio Area Chambers of Commerce, NOAC, to provide trusted consulting and administration services for employee benefit programs, including BWC, FMLA, UC, wellness, rehab, EAP, safety, TeleAdvocacy, and now COVID-19. So today, Peter is going to be telling us about workforce benefits in a COVID-19 world. So COVID-19 is forcing employers to rethink how they do business. Smart employee retention and recruitment has become one of the drivers of business success in our new normal. Peter will help fit the puzzle pieces together for us to begin explaining how smart benefits management creates value, saves time and money, and controls our business risk. So Peter, I'm going to go ahead and turn it over to you.
Good morning, everybody. I will try to keep this to I guess we get about 45 minutes here, so we'll jump right in. There's a lot going on, as we all know, and I'm going to try to focus on some important U.S., Ohio, and local benefit programs. You see them listed here. The second bullet is not a program, but there are, and I've been getting help from some of the attorney and insurance organizations that we know, look at some of the emerging liability issues that are happening now that businesses are reopening here in Ohio and around the country. But all of these are areas we're going to just touch on because we certainly could go a lot of time on each one of these, but we'll jump in and get some high-level information in your hands. And as I said, you're welcome, by the way, to have this presentation. Let me know or let the New Image Media folks know, and we'll get this to you. Hopefully you'll find it interesting enough to want it. Real quickly, just in kind of alphabetical order, let's start with the BWC, or Bureau of Workers' Compensation, or for those of us that do some with this, we also call them the Because We Can organization. In Ohio, the Bureau is the only insurance organization, unlike 46 other states. So they make all the rules, and TPAs and MCOs and organizations like us are kind of the distributors of those services and programs, etc. Today starts Bureau Year 2020. It's July 1st. The Bureau Year runs July 1 to June 30. So some of the things that you see in here are related to 2020, but also it's the time of year when the whole world that I work in starts bugging all of you about programs for 2021, believe it or not. So we'll kind of talk a little bit about that too, but some real high-level stuff. The state system started the year with $11 billion more than they need to run the state system as a conservative insurance organization. They gave over $1 billion back last fall. And to help small businesses in Ohio survive and get through this pandemic, they gave another $1.6 billion back this past April. It was 100% of what employers paid in Bureau Year 18. I'm just throwing the thought in there, did you get the correct amount? Because there were some adds and subtracts from that $1 billion back. So that's something that folks like us do for our clients. The other thing that the Bureau did in April and May was, out of the goodness of their heart, they decided, since many, many businesses in Ohio closed down for 2 to 3 or more months, they reduced everybody's estimated premiums for the year that starts today. And that can create some headaches. We'll certainly don't have time to get into all of those pluses and minuses. But you may see that your estimated premium letter that you got from the Bureau or emailed to you showed a much different profile of what your business might look like this year. So I am also suggesting, is that something that you're comfortable with? Is it correct? There are ways to amend that. The next thing they did last month or in May was they decided, again, to try to help businesses with cash flow, to defer the June, July, and August premium payments for this year. Again, we just started Bureau Year 2020 until, as they said, September 1st. I will tell you that that's a little bit misleading, but the good news is you can defer payments until September 1st without penalties or interest. If that helps you with cash flow, go for it. What I will tell you is the real due date is August 21st. They have said September 1st, which is fine, but that's when insurance policies would lapse starting September 1st. And if you've gone through this drill with the Bureau, you know that you need to post your payment to them and have them post a payment in their system by September 1st to really avoid any lapsing issues. So again, the real due date is August 21st. That's fine. Go for it. That helps. Also know that if you're used to doing this Bureau thing, that you have what's called a true-up for previous Bureau Year 19 due by August 15th. So just watch the cash flow. You may have a bunch of payments due to the Bureau in August if you defer things. So keep an eye on that. Get some help if you need it. The last bullet is about next year. So if you haven't already, those of you who deal with workers' comp, been getting inundated with stuff from companies like us, just know that the group rating season has begun. It goes until November. So by the way, if people are telling you need to sign up yesterday, that's not true. That helps them, doesn't necessarily help you. But I am going to pose a question to all of you that deal with workers' comp. Group rating, which is what everybody wants to be in, it's a premium discount program. It's been the best discount process the state has offered, may no longer be your best option. And you'll all say, what does that mean? Well, there is another program that the Bureau has changed the rating and refunding process for, called group retrospective rating, that may actually be a better deal. In green, folks like us who offer evaluations to help you make smart decisions. I'm here. We are members of a number of the chambers now in the NOAC system. We do free evaluations. We welcome a chance to give you a second opinion. Make sure that you're getting the best plan that fits your business. So just an FYI on that. An area that we've begun to really help in the system with small businesses in the chambers is to make sure that self-employed professionals know that there really is a place for workers' comp in your world as well. So pose a couple questions. I've begun to get some small and self-employed employers to look at this. What happens if you have a work-related accident? That could be a car accident, a slip and a fall, whatever. Or you get sick from COVID, God forbid. Does your health insurance, these, by the way, could be work-related, as well COVID could be. We'll talk about that in a few minutes. Does your health insurance cover the medical bills, the rehab costs, specialist costs for a work-related accident or illness. Most regular health insurance may not because it's work related, whereas healthcare is healthcare. I don't sell insurance. There may be insurance people on this call. I've had lots of talks with folks like that. You may not have that coverage. And then, oh, by the way, the fourth bullet, what happens to your business if you can't work and earn an income? Well, believe it or not, the Bureau, for as little as $120 a year, not a month, offers workers' comp insurance at zero deductible, zero copay, zero coinsurance, and income replacement as another approach to helping you as a self-employed professional. God forbid something happens to you. So I just want you to put that out there. Please contact us. We're happy to help you figure out how to do this. FYI on this. Startup businesses. The chambers, all of your chambers that you work with are here to help you if you were a new business or if you have friends that are going to start up businesses, get a good head start. If you are going to have payrolled employees, W-2 employees, you're going to need to get workers' comp insurance right from the start. Those employees deserve and are eligible for workers' comp insurance, and you need to provide it as the business. There are deadlines to do this, and what I would suggest is contact your chamber. As I said, again, we're happy to help you figure out as a startup business what to do. So that's about enough for workers' comp. Let's jump into some of the potential or emerging liability issues that we're seeing in the marketplace that we are getting questions from many of our clients. So let's start with teleworking. So teleworking means that the home has become a workplace. And all of the rules that you're seeing from CDC and the state, I think our state's probably doing a pretty good job of explaining and educating, communicating what we all need to do. But now we got to think about the home as a workplace too. So as you have employees working from home, they need to make sure that they're doing all the same things that they might be doing if they were in your offices, such as sanitizing and disinfecting. Ergonomics, a big one that we're seeing, because depending on the workstation that somebody has, are they really sitting comfortably and smartly? Are they able to work without straining their back or their wrists as they type? Safety. I've already talked to a couple of employers who have had employees, believe it or not, who've tripped over their laptop cord and have sprained something. So safety in many different ways is important. PPE and masking and social distancing, maybe not so important at home, but if your employees go out and shop, go to the grocery store, and they need to follow the rules that Ohio is suggesting, but also know that if they come back to their home with a problem or with an infection or a potential infection, this is bringing it to the workplace. And we'll talk about the fact that COVID infections, et cetera, can become a work claim in the workers' comp space. Training. Document anything that you're doing and offering the ability to telework for your employees needs to be documented. Training in some of these areas is really important in case, as we get to in the next slide, things come up that may create claims or legal cases. And finally, last but not least, I certainly don't get into data security, but we are a medical organization, and private health information or private financial information now getting more and more out into home teleworking situations. Make sure that security of your data is front and center. Rebecca Armstrong is waiting to get into the meeting. Somebody will probably let her in. All right, this is a slide that I will tell you that I've had a lot of help with. I am not an attorney, so we're going to talk very quickly about some emerging liability issues. We have one attorney I work with, Liz Crosby, introduced herself. She and I've talked to several others. I've talked to insurance people about some of the things that you're going to see here. These are emerging. It's probably not a case of if claims or lawsuits are going to happen, but more a case of when. So being on top of protecting your businesses and your employees is a huge issue. Again, documenting what's going on is big. So briefly, liability waivers, having guests, customers, vendors, repair people, your teleworking folks. There are businesses that are asking people to sign off and that they will not, for lack of a better word, sue the businesses that we're talking to because they have either been exposed or contracted COVID. What little I am not an attorney, but I don't know how enforceable these are. Certainly do not know how much this is going to happen, but they are beginning to happen. People are being asked to sign things. I don't know if you don't have to sign one because it means that you probably signed off on your ability to sue for negligence. Again, what I've read. But if you don't have to sign something, don't. But if you do, know that there probably are ways to look at it as being unenforceable. Derivative exposures, the word that I've learned in the last couple of weeks. Derivative means, again, family, friends, people that you interact with are considered derivative exposures if you get it as an employee or as a person. So there are claims and cases going on with death claims based on somebody contracting COVID from their family member who is an employee. Does that mean there is potential for that to become a lawsuit to the business? I guess it does. Workers' comp is a no-fault system in Ohio, which means in the basic sense that if an employee cannot sue their employer for exposures to COVID, it could become a workers' comp claim. There's lots of things we could talk about with that for a half an hour. But to get it out of the no-fault system that Ohio has, I understand that in some jurisdictions, public nuisance cases are being filed on top of that because they can't sue the workers' comp system. We talked about negligence and wrongful death cases. These are all emerging. These are all beginning to happen. And as the attorney told me, it's not if, but when. Now, a lot of this, I understand, could be potentially covered by the general liability insurance that a business has, but according to some insurance folks I've talked to, that those riders or extra, this is an extra type of insurance, may not be in the policy that you currently have. Check it out. This may cover a lot of the types of lawsuits that may occur. You can decide with your attorney how much you want to fight or not fight these kinds of things. I will tell you, if you document and follow CDC and OSHA and Ohio rules, you've probably protected your business as best you can. So be smart about this, know that it's coming, and just be prepared. I threw something in media and crisis management. One of my clients talked to me very early on, probably in April. One of their home health care aides was working with one of their clients who told them after their initial meeting that, oh, by the way, I tested positive. So the employee came back to work and told the boss, my client, but by the time they did that, they were in a room then with many of their other coworkers. And I don't know if you remember back in April, I haven't heard too much about this recently, but home health and nursing homes were in the news as the crisis deepened, and exposures were occurring and people were getting sick, the media began to go visit or talk to some of the organizations, and they were very worried, as was this client of mine, about their company name getting out in the news as being a place where there was a lot of sickness issues. I know somebody in crisis management and media who I had them contact to be able to try to get out in front of the media coverage. And thankfully, nobody in their business got sick. So crisis averted. But know that that type of information may get out into the public, and you may want to control the news or information before it controls you. Some more things to think about. So we talked about workplace exposures and infections, and the Bureau is accepting cases. Typically, in the Bureau's case, the burden is upon the employee to prove that it was work-related. OSHA looks at it a little differently. OSHA more is looking at the employer maybe having to prove that it didn't happen at work. Oh, by the way, a workers' comp claim, if approved for COVID, could create an OSHA recordable type of claim. And for those of you that worry about OSHA recordables, COVID could become that type of situation. Accommodating disabilities. So we all know that we're supposed to probably mask while at work, if not other places. So I have had some clients talk to me about employees who have COPD, allergies, and asthma who say, I can't really do my job and wear a mask. I can't breathe well enough. So now you're going to have to deal with, as an employer, employees that can't follow all the smart things that you want to do. So you're going to need to accommodate those kinds of potential disabilities. By the way, the American with Disabilities Act guidelines are out there for disabilities. There are other types. That starts at 15 employees. So businesses with 15 or more employees are covered by ADA guidelines. So keep an eye on that. The newest thing going on is employees are potentially refusing to go back to work because they're scared, or they're concerned, or they have health challenges. And just last week, Governor DeWine signed an executive order, and this relates more to unemployment, or UC. But if, as an employer, you've offered the same type of work and position to the employee that they had before, the employee must now show good cause to continue to receive unemployment benefits. They just can't refuse. There are 5 good causes for that in the order. I won't read them all to you. Let us know if you need to get a hold of that. The one area that has not been included in those 5 good cause examples is taking care of child care issues. That does not qualify as a reason to continue to receive unemployment benefits. That's going to be very changeable, I think. This is a brand new order, so stay tuned on how that works. We are trying to keep up on this because, again, we do a lot of unemployment work for clients of ours. But let's go back here. Childcare may not be covered for unemployment, but a relatively brand new federal law called the Family First Coronavirus Response Act, which was signed at a federal level back on April 1st, and at the moment goes through December 31st. And by the way, it covers employers with 500 or fewer employees. There are some exceptions to that. Does offer family and medical sick leave to take care of potentially children whose natural place of childcare has been impacted or closed due to COVID. So you may not be able to get unemployment, but you may qualify for this. By the way, there's also paid sick leave. This is a look at the poster that all employers that should be covered by this or need to offer this. This is what it looks like. If you don't have this, you can find it, or just let me know, or your chambers or NOAC know. We all have this and can get this to you. This needs to be posted or emailed to your teleworking employees. There's a lot here. There's qualifying reasons. There's ways for some employees to be considered eligible or not. The sick leave entitlements are different depending on whether it's paid sick leave or the expanded family and medical leave part. It can be up to 12 weeks. So if you are not aware of this or not sure if you're covered by it, we have this kind of relates to FMLA, which we'll talk about in a second. We certainly are in the management of administrative services, et cetera, for FMLA. So let me know if you need some help with this. As I mentioned, there is, by the way, I didn't mention, there is a Department of Labor, which DOL is, that is who is driving this program. They have a FAQ, question and answers document that's 93 total questions. It's about 60 pages. If you haven't read this and you are an employer that needs to understand this, I can email it to you. There is a link that I can send to you as well. Here are some areas of this document, questions that relate to different things going on with this record keeping. If you need to provide this benefit to an employee either for 2 weeks of paid sick leave or for up to 12 weeks of family taking care of children, you need to record keep. And one of the good news things with this federal act is there would be, for an employer that offers pay for this, to get tax relief. So you need to record keep for not only the leaves themselves, but the IRS tax record keeping. So there's a little bit in this 93 questions about that. Bringing people back to work, and some of the questions about there are small business exemptions, so quarantining, childcare provisions, lots going on in these 93 questions that are very helpful. It hasn't gone up in terms of questions lately. I just checked this morning. It's still at 93, so maybe this act is getting some stability to it in terms of not changing. So let us know if you need to look into this further. FMLA, Family Medical Leave Act, again, a federal program for employers with 50 or more employees, so that may make a number of your smaller businesses not have to worry about this. The reason I have it in here is because FMLA offers 12 weeks of unpaid leave to take care of family and children. It may overlap, therefore, with the Coronavirus Act we just looked at, which is paid leave. So you need to be able to navigate the two acts together potentially to help your employees who have childcare issues, if nothing else. And these are some of the question areas in the Department of Labor document I mentioned a minute ago, the 93 question one, that would cover some of the overlap of these two federal programs. We'll switch back now to things that you can do to improve or enhance your business. And Ohio, believe it or not, is, I think, has a lot of foresight and is a leading organization to try to help organizations with safety, return to work, wellness, drug and alcohol testing. There's a ton of free grant money in Ohio to help employers put in place improvements to their practices and procedures when they do not have the time, budget, or expertise to put these programs in place. You get a little bit of a sense of the amount of dollars involved. And then firefighter, law enforcement, school safety, and developmental disability grants are a lot of money, not in the $40,000 range, but in the somewhere in between range of these. It's a lot of money out there. This is free money. If you have a workers' comp policy in Ohio, this is your money. Go get it. Go take advantage of it. It will help your businesses. We get involved in all of these programs all the time. Happy to help you navigate through how they work. Do everything you can while this money is out there and the state is in a giving mood to take advantage of it. That's all my advice would be. Here are some of the This is, by the way, this money is coming from our wonderful, again, Bureau of Workers' Compensation system. Here is actually some of the documentation. I know it's hard to read, but I want you to see there actually are places where you can get information about these grants through the Workers' Comp website. So you're free to go look for this stuff. Again, let us know if you want some help trying to figure it out. Ohio Department of Job and Family Services. Don't know if this is a well-known program, but they have a program called SharedWork Ohio. And we've helped a lot of employers try to avoid complete layoffs or partial layoffs through taking advantage of SharedWork Ohio. If you have 2 or more employees and you've been experiencing or may in the future experience reduced business activity, instead of having to necessarily lay people off or reduce their hours and therefore have to retrain staff to do other things that they weren't ever able to do before, or to look for how to reorganize operations, you may be able to take advantage of this program and help an employee receive unemployment benefits as an offset to the reduced hours that you now are only able to offer them. There's the link. I believe it also can be set up to meet the Federal CARES Act PPP program requirements for not laying people off. That's what I've been told. That's the link. This is what the document looks like as a fact sheet. So if you have been trying to deal with this, or you see your business slowing down, or you need to plan for that, you might want to look into this program. It has really made a difference in about 10 employers that I work with who have either had to go through partial or total shutdowns, are now coming back, but are seeing that business is starting off slowly. So a really interesting way to, and as I said, they had never heard of this before. So you can find this on Job and Family Services website. Let us know if you need to get more help with this. The Ohio Reopening website that's out there has information about this, but it may be a real smart opportunity to help you and your employees. Switching to a new benefit that's maybe out there. So including COVID, but my goodness, we just finished the flu season, at least I think we have. That'll come up again probably this fall. Here are a lot of ways that people get sick, and I'll tell you that every one of these 6 examples are something that I've dealt with. Thankfully, my kids are now full grown, and I wish I could look at the things we're going to talk about in a minute here when my children were really young, because one of the things they had, pink eye all the time, never seemed to happen except in the most inconvenient times of the day. Hourly employees, unrelated to COVID, if they run a fever or start feeling sick or whatever, and they are working, if they're hourly, they now have to make a healthcare decision. Do I keep working, or do I go try to see a doctor or go to urgent care? If they aren't working, they can't earn a living. If your hourly employees aren't working, you now have to cover for them. So this becomes a business interruption issue. I thankfully still have elderly parents who every once in a while forget their prescriptions or prescription refills, and who do they call? They call me. So that's a real challenge when you're trying to work. My spouse and I went on a vacation a number of years ago. She developed a throat infection, and we're away on vacation, not anywhere near somebody that can help us. I have strained my back on a business trip trying to get exercise and did myself a bad thing. And then I had a child develop a rash swimming in a lake on July 4 a number of years ago. The common theme here is the inconvenience, the hassle, the inability to get quick care that you know and can trust, and maybe even need prescriptions. So where I'm going with all this, and here are the types of things that we typically get sick with. All of these things you can take care of by going to Emergency care, your primary care physician, if you can get in to see them in time. Urgent care centers, if they're open. Retail clinics like Walgreens and CVS, if they're open. And we all have heard about telehealth, but all of those previous conditions can be potentially handled through a telehealth video or phone call quickly and very inexpensively comparatively. Urgent cares have very limited hours, and patients have told us that these are the types of places their primary care physicians, although nowadays the wait time can be very difficult to get in and see somebody before a couple weeks go by. Emergency care, these are places that people would have sought treatment from if their telehealth provider was not available. So I don't know if all of you have telehealth, but here are some statistics about the types of things that could be handled by going for non-emergency care to your phone, your smart device. And oh, by the way, the last bullet, many millennials who don't feel they are ever going to get sick don't have a primary care physician. Unfortunately, 25% of our adults don't have one. And the real challenge nowadays is that so many people who are out of work may no longer have access to health insurance. And do they therefore have access to regular healthcare delivery and access? Maybe not. So we've all heard about healthcare over the phone or a smart device. Telehealth is the word. I will tell you that telehealth is really available everywhere, it seems like. But that's not the answer, the only answer to taking care of non-emergency things quickly. How many of you are juggling jobs, kids, elderly parents? If you are, we're called the sandwich generation. That can take an awful lot of time and a lot of stress. If you're trying to juggle all those things and try to figure out what to do, where to turn for help, where to go for help, and get it all done in 24 hours, I feel your pain as I'm trying to still deal with, although my kids are a little more grown, they're still in my face about stuff. There are, besides telehealth, a bunch of bullet points that you see on here that services are beginning to offer, kind of, we'll call it concierge type services, to help you deal with 24/7, getting help for lots of types of conditions or situations that you may not have a lot of time to take care of. I will tell you, the doctors online, I have this service. This is something that we offer. There may be others, but a combination of all these services have been wonderful for me to try to get 24/7 nurse call help, second opinions from research professionals, explanations of a healthcare bill or a claim, second opinions of treatments, lots of work-life balance services that are available through this. The biggest thing I want you to see on here, besides the additional resources that you may not have access to through your doctor very quickly or easily, or even through your insurance carrier, is the discounts off of prescriptions, as well discounts off of dental and vision services and wearables. So you get and many of these services, many of the systems that are out there that do, you become a member, you'll get a membership card. I take my prescription card to my favorite pharmacy all the time, and along with my health insurance card, and say, what's going to give me the best discount? And I am surprised sometimes how my membership in this TeleAdvocacy program beats the discount savings I get from my regular health insurance. I'm also showing this all to you because for those who do not have health insurance currently, or can't afford the deductibles and co-pays typically, maybe this is an alternative way of managing precious dollars and consumer spending in the expensive healthcare world that we live in. You can get these programs with as a not insurance again, but as another way to take care of your health insurance costs. And if you don't have health insurance, this may be a lifeline for you. So I want you to kind of get a sense of the other things in the concierge type service programs that are out there that are not just about telehealth. These are some of the plan options that are available. Won't spend a ton more time on this, but it is a new world for healthcare. As we all know, you don't just have to go to a bricks and mortar place anymore.